Are we live?
Yeah, we are.
Hi guys.
Welcome back to a podcast about nothing with V.
And AD. I
We've
hope it's not
said we've said that a lot this week.
really.
Welcome back.
Yeah, that's good though.
It
We're
is.
coming live from our hideout corners.
Right. Live from the bunker. We have another special guest, another celebrity.
Very special guest.
Tell the people who you are.
I am Dr. Christina Brooks. I am a licensed psychologist in Maryland. I own a private practice. It's called the Anxiety and Behavioral Health Center.
Yay! Thank you.
Yes, she's gonna help us get our mental right. Help all the people because we are in some trying times right now.
Seriously, especially, everybody is so worried about the actual physical, being able to contract and avoidance and all the things that we need to know on the outside. But nobody ever considers their mental health when it comes to things like this. And I do feel like this is different because it is considered a pandemic and something I've never experienced in my lifetime or really understand. So I appreciate you coming on because my mental is something we always worry about. So the fact that I can ask you questions is exciting for me. So let's get to it.
Yeah. So I want to start by just, for everyone that is listening in, kind of give them a background on what anxiety and behavioral change, what is it?
Yeah, sure. So anxiety is a normal natural response that we all have to a feared situation. It's something that we have to have. It's like just a part of our makeup as humans. It's our survival instinct. It's what keeps us alive. And when we're anxious or fearful of something, our automatic reaction is to fight or flight or freeze or self-preservation, like to protect ourselves, to keep ourselves well. And so anxiety, by and large, in and of itself, is not problematic. It's actually something that's really, really helpful to have. And I think that, right now, especially, there's so many people who are saying, I'm feeling really anxious about this, about COVID-19 and about the health effects. And it's a normal response to a world health crisis that's going on.
Yeah. I always say, especially to my daughter, like it's okay to have some type of stress. I think it's good to have some type of anxiety. I think when it lingers for a long time, or when it consumes your day and your thoughts, that's when it becomes, a really big issue. Has there been an increase in patients since this pandemic?
Yeah, there has certainly been an increase in calls and an increase for services. And I think that that's a normal natural response. And I'm glad to hear that people are reaching out, because it's saying that people are recognizing that this is impacting them and, in these really impairing ways. I think you hit it on the head when you said, when you talk to your daughter about hey, anxiety is normal, stress is normal. It's just when it starts to impact your day to day that it's not normal anymore, So a certain level of stress is normal. We want a certain level of stress to make sure that we are prepared and we're doing well in the things that are important to us. And, normal fears are normal. It's when the anxiety and the worries and the nervousness and the fears causes us to avoid those things that we're afraid of. Is what actually perpetuates the disordered anxiety. But what we're seeing in a lot of people is not what's going on in terms of their reactions to COVID. It's not disordered anxiety. It's perfectly normal and natural anxiety. There's so much stress that is happening. I mean, you think about the health concerns, number one, and people who are vulnerable, and how do we protect ourselves? And so that natural want to pull away from people and to avoid people, or our natural want to like wash our hands is really to change our clothes, to like, check our grocery bags when we get home, to wear masks in public. It's a normal response to a very real threat that's going on. So I don't think we're necessarily seeing that disordered anxiety, at this point in time. I think we're seeing people's normal reactions.
Yeah, that was the next question. Like, is there, can you experience, anxiety and depression without it being a disorder? Like, is there such thing as crisis anxiety?
Yeah, absolutely. Yeah, absolutely. I think that we can all relate to times where we have where we have felt like overwhelmed in response to a crisis situation, whether that's because, we lost a job, or if it's because that there's health issues within our families, or we've lost a loved one. That we've all experienced that. I think where it becomes like disordered is where it is impacting your day-to-day life. So if you are finding that you are worrying excessively and you're having difficulty concentrating, or you are feeling really uptight and on edge, or you're having trouble sleeping, or you're really short-tempered, we may or may not have experienced that in our household recently. Those are signs to look for, also physical responses. Stomach aches and headaches, especially in kids, but also for us adults. How do you guys, how do you know when you're feeling overwhelmed or overly stressed?
And that's the thing. I don't eat, and I love food. That's the first time when I lose my appetite all over. I know it. So that's why I'll be okay up until like a couple of days ago when they told us to shut down.
And I am the exact opposite. I eat. So when I get stressed, and so like I was joking with somebody earlier, you've heard of like the freshman 15. I think we're going to have the COVID 20. Yeah. Like I walk out of my house and be like a balloon by the time that, we're allowed to.
I definitely agree with that.
There's, but there's like, those are two other signs to look for if you're experiencing disordered anxiety, if it's going on, and it's impacting you, and you're eating a lot more than usual and gaining a lot more weight, or eating less than usual and losing a lot of weight. Those are signs to look for as well.
Have there been any like coping mechanisms that are different from your usual patients that you've offered to newcomers or people who've never existed?
Yeah. I think without getting too much into it, we know that like the best coping strategies for dealing with anxiety and depression have to do with understanding the way that we think and understanding the way that we relate to our thoughts, or the way that we think about our thoughts. So and then the other part of it is also understanding the behaviors that we're engaging in, or the activities that we're doing, and understanding, are those helping our emotions, or are those hurting us? And so, I've been talking with a lot of people just about, and I do in my day-to-day work, I do cognitive behavioral therapy, which is exactly this, just addressing people's thoughts, patterns, and their behaviors. And so one of the things that I've been talking with people a lot about is, of course, we're going to have these worries about what's happening out there, because again, it's a really real threat. And not only is it a health threat, but people are facing really tough financial situations as well. And kids are facing really difficult changes that have to do with not being able to go to school. And for a lot of kids, school is their safe place. For a lot of kids, school is like the place that they go, and they can feel like there's consistent structure, there's consistent routine. And so they're missing out on that. And I think that scares a lot of kids, and it worries a lot of kids. Like a lot of the kids that I've been working with this week and last week have been saying, I'm worried that we're not going to be able to go back to school for the rest of the year, And so one of the things I've been talking with people about is, worries are good. We need to have worries because, again, they keep us prepared and they help us to problem solve. So with this idea of like, I'm worried that I'm not going to be able to go back to school. Well, that's an okay worry to have. Let's kind of work through that and let's think about, are there things that you can do to help like adjust and adapt to these changes that are happening? So like I was talking with somebody earlier today who was really afraid that, or really worried that she wouldn't be able to do her science fair project. She wouldn't be able to do her international night.
Aww.
And other things that like she really looks forward to. And so we were like, well, what are some things that you can like how can you adjust? It's not ideal. It's not a great situation, but how can we
how can we make it better?
Yeah. And so she came up with the idea of having a science fair with her family. And she and her brother were going to create science fairs, and they were going to put together posters for their family. And then she was going to, once a week, she was going to study a new culture. And then at the end of the week, the family was going to make a food from that culture together. So that was the other thing, is just talking about like, with people, this idea of adaptability. With change, we have to adapt, and we have to find creative ways to kind of to cope with these things. The more fixed we are on thinking about, well, this is not the way it should be. I can't believe that this is happening.
Yeah.
Those are thoughts that aren't so helpful for us in adjusting and adapting to the current situation.
Yeah. Yeah, those are all great. I love the science fair project with the kids. I think that is, and that was next question is like, with the schools being closed, and I feel so bad for the seniors. I really do. No prom, no graduation. It's like, what can the parents do to ease the stress on all the kids, but definitely these seniors? And I pray that they get together and do something for them once this is all over. It's all up in the air, but like, what can parents do to just kind of ease the minds of what was taken away from these kids?
Yeah, no, I think you're right. It's a major loss for them, and there's then like a grieving period that they're going through, so they're experiencing all the emotions. And I think it's easy for us as parents to be like, get over it. It's a year out of your life.
Yeah.
Look at these people who are sitting in hospital beds and who are losing their lives, and you're worried about going to prom. Like, come on, But I think that just drives kids and adolescents more away and has them like put up more armor and more of a big fear. And I just think about like, remember high school? Like, high school were fun times for most of us, for a lot of us. And like, your senior year was fun. So I think just like validating their loss and validating that this is a sucky time for them and that it's not enjoyable, and they are losing out on all of these ideas about what their senior year was going to be, and you're a freshman, and I've heard a lot of seniors say, when I was a freshman and I was going into high school, I was like, I can't wait to be a senior because I can't wait for this and this and this. And they're here, and so it's a major loss. So I think just validating that it is a tough time for them, and then like you were saying, can they come together and can they create other traditions, or like how can they adapt? How can they be creative? How can they adapt to these changes?
I have a cousin in Sacramento, and I think about all the athletes during this time, the basketball players and stuff like that. Like they have colleges coming out to see them, and they have their championships, and they'll never get to know what that last game would have been like. But I do think once this is all over, they can recreate those situations. Like the schools can come together and do something for them. It's never too late, to kind of make them feel better. I'm all for it. I'm all for making the kids happy.
And then like they're also, this is the generation who is, I feel like if anybody can adapt well to these changes, it's going to be them, because technology is already such a huge part of their lives. So like, I was just before we hopped onto the phone, like I am so technologically, I don't know, stunted. I don't know. I'm with technology, but I think that, you know, these kids have grown up on it, and you know, they're super creative, they are super bright. And I think that if they can use these strengths that they have to figure out new traditions and new ways to celebrate these achievements, because like, let's not let these achievements go unrecognized, you know, just because they can't go to school, you know, for the rest of the year doesn't mean that they haven't worked hard to get where they are. So
that validation is going to be very important for them, because of everything that they're missing out on. And then, you know, go down to the smaller kids, and news is everywhere. And it seems like at some point in time, everybody's just looking at the TV, and everything's so scary. Everything is red and dots, and the world is sickness and death. And my 5-year-old understands, okay? Like, he'll hear those words and he'll ask questions. And we've started to kind of remove him. But, like, what would you suggest for people with younger kids? How can they explain what's actually happening? Or should they explain, or just let them figure it out 8 years from now when they teach it to them in history?
Somebody's history book, right?
Because this one is going down. This is one for the books, okay?
Yeah. Well, I think you're right. There are so many scary images out there, and there is an abundance of information, and just like a deluge of information that is being thrown at us all the time. And you know, when we are like, when there is an uncertain situation that we are faced with, our automatic reaction is to seek certainty. And so one of the best ways that we can do that is seeking out more information. You know, it gives us a sense of security. It gives us a sense of control. And so I think we are prone to seeking out more news and more social media and see what's going on. But the reality is, and what the research shows, is that actually seeking out a lot of that information is much more detrimental in the long run to somebody's overall mental health and psychological well-being. So what studies show is that even after a crisis is over, if somebody has consumed a lot of that information and is, you know, overloaded with that information, that they actually experience more long-term negative effects psychologically. And so that's why you hear everybody saying, limit your media exposure, limit your social media exposure.
I have to pull myself back from reading. And that's why I had to confirm with Dr. Della that, you know, I didn't want to make sure I was reading credible sources and stuff like that, because it's an overload and I panic quickly. So,
yeah, I think
I have to pull back.
You may have that person who has anxiety or stress when, you know, looking all day at the news, but it also could have the same effect if they're not, you know, you know, and I don't know if that is a real thing, but I can only imagine that if you feel the anxiety when you're looking at it, if you turn it off, because that's just the natural, like, that's just the common sense thing, turn it off, walk away. But there's a reason why you can't. You know, it's a reason why you sit there and you look at it and you subject yourself to that, you know, anxiousness that you feel. What can that person do? Should they limit their time? You know, just take it in at spurts? Because some people just have to have it.
Yeah, no, I think you're right. I mean, you know, I think that there's a balance here, and it's in moderation. So absolutely limiting your time that you're watching the news and limiting the news sources that you're watching. So, you know, we in our household have found that the more just like you, Adrienne, like the more that we are consuming news, the more panic we are feeling and the more on edge we're feeling. And so we have a rule now where we watch the news once a day, and it's at the end of the night, and we watch news from a trusted source and from a source that is not kind of like inciting fear. You know, those kind of like run-of-the-mill kind of like CDC, you know, World Health Organization, sources where we can get our information from, like more data, like more graphs, more charts, just kind of like really boring stuff that is not going to interest our kids, where they're going to be like, okay, I'm leaving the room now because this is really boring, but where we have the information to inform us. And actually the research shows that the more that we are getting our information from trusted and reliable sources and consistently, but in a limited way, the better we fare emotionally after a crisis like this, And in terms of like talking to kids about it, they want information too. Yeah. They want to know, like they want a sense of control. And so I say encourage those conversations. And I think it's important to have an open dialogue, but a developmentally appropriate dialogue with them. So, for your 5-year-old, you would just answer the questions that he's asking, and I think across the lifespan, you just answer the questions that they're asking. Don't provide more information than that, because the questions that they're asking, like they're leading the conversation then. They're saying, I'm ready for this information, and you can give it to them.
Yeah, my kids are nosy. They're all up in the conversation.
Yeah.
Yeah. So.
We have one of those too. She's amazing, but she is a lurker. So she will just like stand behind you and just kind of like, oh, I'm over here doing this, but she is listening to every word.
Yep. We have a lot. Yes. Adrian.
That proves that point that like when there is uncertainty, when there is anxiety, we want a sense of control and we want more certainty. And so we get that through information. So I think the other thing when you're having these conversations with kids and giving them that developmentally appropriate information. So it's a disease, and it's a sickness, and it does impact a lot of people. That you're also doing so in like a non-emotional and very neutral and very calm way. Calm is contagious, and that's exactly what we want to model for our kids.
Yeah, that's a great tip.
Because I know a lot of parents will inflict their fears onto their children very quickly, and in a way that will make them very worrisome. And it's like it's really not this serious, but okay,
So they could save the talks about finances and family members and the details about their illnesses. Save those conversations for when the kids go to bed, or save those conversations for when you're walking around the block, or save those conversations for when your kid has, earbuds in and they're doing their thing with like their friends on video games.
Yeah. That makes sense. Sense. There's a lot of people that are alone during this time. There's a lot of, elderly people that are in nursing homes, they can't see their families, a lot of people that are single, that are just, they have to work from home, they're not getting out. In order to not feel lonely and anxious and depressed during this time, are there any suggestions that you have for those people?
Yeah. Well, I think that it's normal to feel lonely and isolated and sad during this time. If we didn't have those emotions, we wouldn't be human. And so I think it's okay to allow yourself or allow those people to experience those emotions. And again, just like we do with our seniors in high school, being validated to our seniors who, are elderly, that, this must feel really lonely and this must feel really scary, and finding also ways to support them, finding ways to connect with them, so that there is, again, that balance and that moderation. We're not trying to push those feelings away or deny those feelings, but we're trying to find ways to cope with them and adjust. And so, I don't know, did you guys see, there's this feature on the news the other day of this guy who went and visited his father in the nursing home, and he had this huge picture window, and the guy who went to visit his father pulled up a chair outside of the window and was just talking to his dad on the cell phone outside of the window. So Yeah, I mean, that's stuff that, means a lot to people. Getting kids involved and sending, having them write cards to their relatives who might be more isolated, or friends of the family who might be more isolated, and sending them cards, sending them pictures. Snail mail is such a great way to communicate with people. I heard you guys talking with Dr. Della yesterday about just how, like, maybe this is a way that, unintentionally and with a lot of misfortune, we are willing to reconnect in different ways.
Yeah. Take it back to the basics of writing letters.
Yeah.
We can honestly say pretty much everyone that I've spoken to is on the same thing. Like, yeah, I'm calling a family member I haven't spoken to. I've picked up the phone and called somebody who's elderly who I'm worried about in this time. And that's not even just from family. That's friends. It's random people I'm speaking to on the street. Everybody's really thinking about what matters. So I can believe that as well.
Yeah, and I think that, like, also it's really healing for us, and it gives us a sense of control and competence that we can be compassionate with other people, and that we can contribute to other people's well-being. And that does a lot to boost our mood and to help us cope with our own anxieties and our own sadness. There's, in our neighborhood, there's a bunch of people who have organized like what would you call it? Like a kind of like a feast of sorts, like putting together food to take to the hospital for the doctors and the nurses who are working at the hospital. And, through social media, a lot of people are reaching out and are saying, hey, my neighbor is really struggling. She has a lot of health issues. She can't make it to the grocery store. Does anybody have an extra ham laying around? Does anybody have extra food laying around that she can have, And I found that, like, we're, like you were saying, Adrienne, like, we are just really coming together as a community in large part to help support one another. And gosh, that does so much for the soul and so much for our emotional well-being in our communities.
Yeah. We have a question from Sonia in North Carolina. She said that she's still working and she's annoyed that some people aren't taking this pandemic seriously. She is a breast cancer survivor of 20 years, but she works in a daycare. So she wants to know, how can she address this in a professional way, instead of saying, like, get the hell about my space. I'm sure that's what any of us would want to say, but how can she address it, in a more professional way?
Yeah, that's a tough situation to be in, because Sonia realizes her own vulnerabilities, and I think for those of us who have underlying health conditions that aren't readily apparent to other people, we feel even more worried and even more scared for ourselves, and people don't necessarily recognize that, and so they might. And people get scared too if we do give them that information, or if we, like, let on at all. So if Sonia were to wear gloves to work, or if she were to wear a mask to work, people might really experience that as like, whoa, really fearful, really have their own fearful reactions to it, and recognize her experience with it. So I think just really addressing it very upfront and honestly, and saying, hey, I know that you guys may not be aware of this, but, there are some health issues that I face, and there are certain steps that, I would like to take while I'm at work in order to feel safe in my work environment. And then to talk with her supervisors as well. I mean, depending on what kind of work environment it is, I think that there are, I guess, a lot of precautions that can be put in place as long as people are aware that this is something that you're faced with.
And I know a lot of companies, along with sending out these letters, they're really for their employer as well. So it shouldn't be a hard time for her to get this message over to her supervisor either. Because I do know they're protecting their employees the best way they can, because they're the ones serving us. So if they can't be protective, then Who's gonna protect us? Okay.
Please protect us, please, please.
Please.
Um, there, there's a lot of more people staying home to work, and the students are out of school, and the husbands are home, and the wives are home. I can only imagine the anger that might be associated with this situation, or that anxiety, stress, depression, isolation. What are some things that the kids, the husbands, the wives, like a family as a whole can do to kind of, one, get
Keep
your alone time, but two, cope with all the different personalities that you are used to, but you're not used to dealing with them 24/7.
Yeah. I feel like you have a camera in my house or something. Yeah. As a professional, I know what to say. And like as a mom and as a wife, I have like the reality of it. I mean, we're all here. It's tough. And people do the best that they can. I think one thing that's really helpful is creating some sort of structure and some sort of schedule. I know that again, going back to a sense of control and a sense of predictability, especially for kids and young kids, who if you can have them even further, like help you to develop that schedule and have a set routine every day that includes what they would normally do when they go to school. So, getting up at the same time or a similar time in the morning and brushing their teeth and washing their faces and getting dressed for the day. Maybe one day a week you have a pajama day because there's, that's important too. But like keeping the normal routines in place, I think is really important. And then having a sense of predictability throughout the day. So writing out the schedule for your kids and for your family. So one thing that's helped us here in our house is I am doing teletherapy exclusively from an office in my home. And so what I've done is I've created a schedule and I give it to my husband and I'm like, these are the hours that I am not available. Like, do not knock, do not interrupt, like, do not come anywhere near this room. Mm-hmm. And we also create a schedule for the kids. And his job is a little bit more flexible, so he's able to check in on the kids a little bit more. And so, including some sort of academic time that's overseen, but also some academic time that is self-driven. And remembering that kids learn best through play. So it's not always about worksheets. It's not always about online learning, especially for the younger kids. It's about, exploring their environment and using what they have in their environment to learn. And I think allowing them to have a certain amount of freedom to, within that schedule, to have some downtime is really important as well. But having them have a say in it gives them a sense of control and again, just having it laid out and they can see it all throughout the day and what is to be expected really helps to manage some of that nervousness.
Yeah.
What have you guys found to be helpful, V?
Well, the first few days of the week, we just did absolutely nothing. We just kind of laid around in our pajamas.
First week of the quarantine, you quarantined your house quickly.
I did. I took the boys out a week before they suggested, just because Cooper has asthma, and I took Jaden out a few days before they said that the high schools were closed, just because of Cooper, and his asthma and stuff like that. So for the first week or so, we just kind of enjoyed the time together because we're always going and coming. And this, I thank God for my parents, because we're all in the same house. So my mom and dad take the boys, and our daughter, Jaden, she helps a lot too. But my mom will take them from the morning until we're done, working. And from feeding them to, giving them their showers and getting them ready for bed. It truly is a blessing. I have absolutely nothing to complain about because she and my dad, they are both they've done wonders for us. It is different not being able to go to the office and kind of be away. You know, our name gets called, or my name gets called a lot. Uh, yes,
mom.
yes. But I'm grateful for the situation that we're in because
Yeah,
I've seen a lot worse and heard a lot worse.
yeah.
You know, when
You're
it
getting
comes to
like the
this.
other thing that's like really helpful for coping, which is just gratitude. And when we go through crises, when we go through really tough times, it's important to be, I think, helpful to be mindful of the things that we're grateful for, because, you know, there is, there are things, there are pleasant moments within unpleasant times. And so, you know, we are going to, like, our emotions are going to be present where our attention is. So if our
Yeah.
attention is on all of the things that are going wrong, then that's where our emotions are going to be. And so you can change your emotions by changing your attention and what it's focused on. And, you know, the other thing you mentioned is just like the value of being together as a family. You know, it's nice to be able to, and really helpful to be able to reconnect with and to focus on what's important to you at this point in time, and make decisions based on values, instead of, you know, excessive fears and worries.
Yeah. Yeah. Um, so our Aunt Elle from Georgia, she wanted to know what are some coping mechanisms and tools uh, that for someone that already has, you know, depression. But this whole situation doesn't make it any easier, especially with someone who may have lost their job or, you know, is experiencing those hard times.
Mm-hmm. Yeah, it's it's a tough situation, and I think the one thing that can help is just reframing the way that you're looking at it. You know, for somebody who has experienced a lifetime of dealing with depression or other situations in which they've dealt with depression or do have clinical recurring depression, you know, I think that the depression sucks and those times are still hard to get through. And also, they've had a lot of practice for game time situations. So, you know, if they've had therapy and they know some of those coping strategies, or if they haven't had therapy and they
Yeah.
just know strategies that work for them, you know, rely on those, because it's kind of like, you know, times in the past that maybe have been bad but haven't been so bad are just kind of like practice for the game day, you know. And so
Yeah.
here's the game day, and so use what you know and use what you work, what works for you. I think the two biggest things that research supports in terms of helping with depression are perceived social support. So, you know, making sure that you're connecting with people who are going to help to lift you up and who are going to help support you. And who know your struggles and who are validating of those struggles, you know, not connecting with the people who are, you know, minimizing of how difficult this might be for you, but also not connecting with as much those people who will like commiserate with you, because that is just going to make your depression so much worse. So seeking out that like really good social support. And then I think the other thing that research really supports is behavioral activation, which is getting up and doing, which, you know, when you're depressed can be a really tough thing to do. When you've lost your job, when you feel like, okay, the world is against me and you're feeling really hopeless, you know, the last thing that you want to do is to get out of bed a lot of times, or to get out of your comfy chair. And so behavioral activation is taking steps towards doing the opposite urge, taking steps to like get up instead of sit down. So if your normal comfortable position is sitting on the couch and watching your show, maybe you stand up and watch your show instead. If your comfortable position is sitting down and talking to people on the phone, maybe you stand up and talk to people on the phone, but just, making effort and like scaffolded kind of like small step-by-step efforts to get up and to get out. Because I think when we are feeling depressed, our normal reaction is to go down and in, so we just want to like taking steps to do the opposite.
Yeah. I like that. Like I can use it.
Yeah.
We in our therapy session. Help us.
I love what I do.
That's you can tell. You can tell.
It's relatable, like, for everybody.
It is. And talk about it being more and more, open and about the mental health thing. I'm finding that it is relatable and everybody should indulge and partake in speaking to somebody. So this is great.
Yeah.
What are we going to say?
It's a great topic. AD, did you have anything else you wanted to add?
No, I'm just a student today. I just wanted to listen and hear what's going on. Just to make sure I'm crazy over here.
You said it's crazy over there?
I'm all right. I'm not going crazy today. I've been evaluated.
So, Adrienne, what are you doing that's helping? Like, what are you doing to help?
Well, it's so funny because I actually saw a meme the other day that said when everybody's panicking and you realize the life that you've been living is called quarantine already, that's me. So it's not so much panic. It's when I go outside. I'm one of the people who get nervous with the mask things and stuff like that. So it's freaking myself out with the information and stuff. So I've limited my sources. I was, trying to make sure I'm getting reliable information. I've turned my timer on all of my social media accounts, so I'm not seeing more than a couple of minutes, even if for recreational things, just so I don't scroll past and click one too many times just to see what's happening and read on something crazy. So for me, it's more so limiting, staying to myself, being more productive in other areas, doing something creative, just keeping my mind out of where I know I can fall off a cliff and go crazy.
Mm-hmm. Yeah. And people with that already have underlying conditions, and it seems like the media, social media, the news sources, when it comes to this, when it comes to COVID-19, it seems like they focus on only people with underlying conditions are at risk. When you talk about the death toll, it's like, the death toll is that, but the majority of them had underlying risk. Well, these are people who underlying conditions. These people with underlying health conditions are still alive and well and don't have, any issues when it comes to COVID-19. But because the media keeps pushing it in their face, like, I would go crazy. And I felt myself going crazy, wondering if I had any type of underlying condition that I didn't know about.
Yeah.
It's like, and it's like, I know I have allergies, so I get shortness of breath anyway. So I'm sneezing, my eyes are watering, I can't breathe.
I'm like, everybody's holding their breath for 10 seconds to see if they have
symptom. This is a symptom. Like, I'm going crazy in the house. And I'm like, I have allergies. That's what this is. How, like, what should those people do? And I would say, hey, just stop looking at the news. But again, I think sometimes not having the information as well can cause just as much stress. But that underlying condition and news sources focusing on that, what's there for them?
Yeah, I think what you're hitting on is this level of uncertainty that we all live with.
Yeah.
And, this level of uncertainty that I think is really difficult for us to tolerate, which is maybe I do have something that hasn't been identified. And maybe that is something that puts me more at risk for, the more severe effects of this disease. And so, I guess virus. But I think a large part of it is okay, we're going to do that natural, normal thing of scanning our bodies, but to seek information. But it's the same with checking the news. We're checking the news to seek information to gain certainty. We're checking our bodies, we're scanning our bodies for information to gain certainty. Well, we can spend hours upon hours watching the news to get that information, or we can spend a lot of time throughout our day scanning our bodies to gain more certainty. But really, that doesn't get us anywhere that we value. Instead, we're losing out on time of spending with our families and paying attention to our kiddos and asking them how their days were, paying attention to even our souls and our well-being and what makes us feel fulfilled instead of what's wrong with me,
I love that.
Yeah, the more that we're scanning our bodies, the more that we're missing out on other information that's just as valuable to us. And to what extent, to what degree, to what loss, at the end of the day, there is nothing in life that is 100% certain.
Amen.
Well, there's one thing, but it's really grim. It's death.
Exactly. Yep. She's like, oh, come on. Right, exactly. We know that. Yeah.
So, but everything else, you think about, even I thought about my day here in the house, and for the most part, I take the certainty in this house for granted. I go to my room, I do my thing. I don't expect much is going to, go wrong or unexpected, but I take for granted that there is still this level of uncertainty of, what, I could trip and fall down the stairs and tumble to my death, one of the times that I'm going up and down the stairs today, or, if I'm walking by, a cabinet that my husband has left open, I could knock myself out and fall on the floor. But, it's so there are those uncertainties. And I think that we don't recognize those uncertainties until there's something that's really important to us that's involved with that uncertainty. So our health is one of those things. And so I think that there's just a level of uncertainty that we have to sit with and say, what am I willing to do today? What level of uncertainty am I willing to tolerate today in order to do what matters?
Yeah.
That's a good way to look at it.
Yeah, that's a great way to look at it. I need to practice that.
I do think for me especially that I know of, I don't do certain things or would avoid certain things because of the uncertainty that comes with it. So I think thinking about the level that you're willing to go to deal with what you need to is a good way to think about it versus let me just avoid this or figure out another way to do it just so I can avoid this from happening. Or because trust me, I think especially being alone a lot, you think about oh my gosh, I could trip and fall and break my ankles and nobody's gonna know, all kind of stuff in your mind, all kind of stuff. So
yeah. And
sorry to interrupt. There's this guy, Stephen Hayes, and he started, he's done a lot of research, and he around this type of therapy called ACT therapy, which is acceptance and commitment therapy. I don't know. Have you guys ever heard of it?
No, I actually haven't.
It's awesome. He is great. And he talks about this very thing, that there is a certain amount of vulnerability that we have in life. There is a certain amount of psychological vulnerability, and there's a certain amount of uncertainty that we live with in life. And so, his in a really oversimplified version of what he talks about is do things that keep your mind on your values and what's important to you, and act from a place a value instead of a place from emotion or instead of a place from fear. His stuff is really great. He has a book, it's The Happiness Trap, and then there's that's Russ Harris, and there's a companion that goes along with it. That's the ACT Companion. It's an app, and you can download it on your phone, and it's really great. It walks you through daily exercises of mindfulness and value living. I love his work. It's really great.
Thank you for that.
Yeah. So everybody writing. Take your notes, children. Take your notes. Aaron from Afghanistan, he reached out and he wanted to know If you believe that the large disinformation campaign associated with COVID-19 has raised people's anxiety, and if so, why are people so quick to believe and share without proofing?
That's a good question.
That is a good question, and I think it gets to this human behavior that we do, which is we look for information to support our already held beliefs. And when we find that information, we hang on to it. We tend to value that information a lot more than information that might disprove our beliefs. And a lot of the beliefs that we have are like messed up, and they don't help us. They actually really hurt us. But it's a human response to look for and to consume more information and to value that information more. So I think that that's part of the reason. And, one of the things that we talk about in CBT is looking for information to disprove these beliefs, like recognizing which underlying beliefs that you have about yourself, other people, and the world around you are really detrimental to your well-being and are contributing to disordered anxiety or more in like heightened senses of anxiety or more severe sadness, and understand what thoughts and what beliefs are contributing to that. And then we help people and like train people as a skill to look for information to disprove those thoughts or to disprove those beliefs. So we can have a more balanced way of looking at ourselves and other people and at the world around us.
That's true. I'm noticing with dealing with more people and trying to figure out the way they think or move or operate, that people often go based off of what they believe and feed into what they believe already from the information they speak or what they want to spill onto you or what they're trying to teach you or whatever the case may be. And I noticed the difference in someone who's just speaking all day is trying to be a student at the same time. So keeping your mind open to understanding how you believe something, but realizing that your beliefs can be true to you, but there's other information in the world. It's hard to differentiate, but the difference is out there. You really have to stay open to wanting to hear different information if you don't want to scare yourself to death or, stuff like that.
Absolutely. And kind of being critical thinkers about our thinking, not believing every single thought that we have, and knowing that some of them are going to be there and they're just really distorted perceptions of reality, and looking for information that's going to help us.
Yeah. There was a headline today that came across my phone. CNN. It said, here's why coronavirus may be killing more men than women. And it was like, what? That was the headline. And then you read further along and they explain it, but the headlines are what get you. And if that's all you read, sometimes it may not bother you right then and there, but later on you'll think about it. It lingers. It's like, don't give your child, the thing that we talked about with Dr. Della is don't give your child Motrin. It's sending kids to the hospital. I'm used to giving my kids Motrin and Tylenol. Like, y'all, this is messing up my routine, okay? It's messing up my routine. Anything else you want to add for the people? I hope you understood our questions.
No, absolutely. They were great questions. And I could talk all day. And in fact, I do talk all day about COVID-19. And
sure you do.
It's I thank you guys so much for inviting me and talking with me and having this be information that's just disseminated to a lot of different people. Just underscoring the importance of mental health and taking care of ourselves, especially during times of crises, but also recognizing that day to day, mental health is a part of our lives, and just pushing this information forward and kind of giving voice to mental health and the need to take care of our mental health. I really appreciate you guys. Thank you.
Thank you for agreeing.
You.
Be on a show teaching us some things, how to cope, and ways that we can help other people to cope. And we'll definitely put this out there. And do you have any suggestions, resources, tools, or resources for people who may not have the resources themselves to go out and get a therapist, or is there anything online and that you may have a hotline or something like that for?
Yeah. There's so much online. There is, and that's like one of the greatest things, right? And so I think a couple of the credible sources to go to for mental health information, and is one of them is the American Psychological Association, APA.org. Another one is the Anxiety and Depression Association of America, so ADAA.org. Both of those websites have a ton of resources and a ton of information about how to manage your anxiety, how to deal with your emotions, your sadness, the grief, the stress that's coming along with this pandemic. So I would encourage you guys to check those out. There is another website that somebody brought to my attention recently. It's called virusanxiety.com. And they have some really cool resources on there too, and some really great meditations, guided meditations that you can use to help recenter yourself and focus on the present moment instead of getting caught up in your worries about the future. So a lot of great resources there. And then I have on my Facebook page, and I actually should update my website, but I have on my Facebook page resources for kids and how to explain. There's a great workbook on there that I did not develop. There was a colleague who developed it, and it's fantastic for helping kids understand what COVID-19 is and what they have control over and what they can do. And as this is going on, I'm just going to continue. When I find really great resources, I'm just going to continue to post them on my Facebook page. So that's a good resource too.
Yeah. Well, thank you so much.
Thanks for this.
Yeah.
Where can people find you? Social media?
Yeah, social media, Facebook is mainly it. And then FrederickAnxietyCenter.com is my website.
Okay, perfect. And we'll post it down somewhere on here. there.
Right.
Perfect.
And you guys are awesome. I mean, another thing, just humor and listening to people. I love you guys, and I love listening to you. It brings a sense of levity into my life when, there's a lot that brings you down. So thank you guys.
We really appreciate that.
Right. And that makes me feel excited.
Yeah. And if you don't mind, as the questions continue to come in, because we had a few that came in while we were talking, we'll shoot them over to you. And if you wouldn't mind answering them, and we can just kind of post them on our Twitter and Instagram pages.
Yeah, absolutely.
Okay. All right.
No problem.
Perfect. Thank you. Take care of your family. Don't go crazy like we are.
No, take care of yourselves.
All right. Thank you.
Have a good night.
You too.
Bye.